I am Dr. N.K. Venkataramana, neurosurgeon, Brains Super Specialty Hospital. Epilepsy or the fits can be of many types. Naturally, everybody knows normally is that grand mal epilepsy, where suddenly a person will cry with the uprolling of eyeballs, frothing in the mouth, losing consciousness, and there is a tonic-clonic movements of the hands as well as the legs. He will fall down, and sometimes they even pass urine motion, and they remain unconscious for a few minutes and then gradually recover. The moment they recover, there will be a little bit of confusion, and then they gradually become normal. So, this is the typical attack of a grand mal seizure. Similarly, epilepsy can be of many types. So, some of them are called partial epilepsies, where a person will be talking, is called petit mal epilepsy, where the person will be talking, or a child most often, suddenly they go blank, stop, and then they continue from whatever they are doing the next minute, next few seconds. So, this happens repeatedly. Suddenly they go blank, and if it is not noticed, sometimes these small attacks can be missed out, and this is called petit mal epilepsy. The third is the complex partial seizures, or the temporal lobe epilepsy, can have different varieties of behavioral abnormalities and abnormal postures and typical pill rolling movements, smacking movements, lip movements, facial movements, sometimes abdominal pain, and followed by little bit of twitchings and then loss of consciousness. Some of these complex partial seizures, they may not become unconscious, but they have these abnormalities, little bit of confusion. During that time, they do not remember. They will be looking around sometimes, staring, but they will not respond to the questions, and they will lose touch with the surroundings, and then quickly they come back to the normal levels. So, these are the variety of seizures that can happen, and sometimes people are not aware of these other types of epilepsies except the generalized epilepsy. So, quite often these are missed out as behavioral abnormality or some kind of a tics, etc., and these need to be picked up, and some fits can happen only during night times. They are called nocturnal epilepsies, and whatever is the situation, they need to be brought to the doctor. We can investigate, and there is a test called electroencephalography called EEG, and this will really show us the electrical abnormality in the brain.